Hi students, welcome to Nurse Educatrix, and this video explains about research problem, which is the first step of conceptual phase, that is the first step of research process. So the objective of this video is, at the end of this session you will understand what is the definition of the research problem, how to identify a research problem, and what are all the various sources of research problem. So the rest of the criteria, statement of writing research problem and writing objectives we will see in the next video. So what is research problem? It is a question the researcher wants to answer or a problem the researcher wants to solve. So the question which is the researcher looking for an answer through a research, we say it as research problem. The identification and formulation of research problem is the first step of research process, and the selection of research problem has different sources. Definition of research problem. So what is a research problem? According to Kerlinger, a problem is an interrogative sentence or statement that asks what relationship exists between two or more variables. So the variables which are involved in the research and what is the relationship that is shown or given as a sentence or statement format, we say it as research problem. A research problem refers to a situation involving difficult condition that can be investigated through systematic studies. So it is nothing but a difficult condition which is being studied in the research, which is given as a statement. So, and there is another definition of research problem, that is, it's an area of concern where there is a gap in the knowledge between base needed for professional practice. So all these definition explains that a research problem is something what the researcher is looking for in a statement format. So identification of research problem. As we said, when we discussed in research process, in the conceptual phase was the first step of conceptual phase is identification of research problem. So this research problem has to be identified, which is the first step in research process. With this research problem only the further steps will be followed. Generally a broad area is selected and then narrowed down to a specific one. So usually when you select a research problem, you have to select a broad area, and through literature reviews you can narrow down your topic or delimit your topic to a specific one. So the steps of the research process is considered most difficult and challenging, and it needs lots of time. So once you select the problem, the further steps will go in a systematic way, but selecting a research problem takes lot of time. So there are plenty of sources where you can look through those sources for the research problem. The sources of research problem includes personal experience, practical experiences, critical appraisal of literature, previous experience, existing theories, social issues, brainstorming, intuition, folklores, field situations, experience of the field situation, and consultation with the experts. So there are plenty of sources where you can get research problem. So we will see one by one. The first one is personal experience. So it is the researcher's own experience. It can be from your family or from your surrounding. You have observed something which you want to put it in your research. For example, a domestic violence you observe who is an alcoholic, from an alcoholic neighbor, or maybe any life situation which happens in your family, you want to put it in your research, you can take it as a research problem. So the experience may provide ideas to identify several research problems. The example may be like domestic violence against women, or child abuse which has been, you read it in the newspaper, or from your neighborhood you have observed. So all those personal experience can be put it as a research problem. The next one is practical experience. As a nurse, we all, when we go to work, there are a lot of things where you want to do you will get lot of questions where you can put it as your research problem. For example, a very basic thing like hand hygiene, which you have studied in your book as 8 steps or 6 steps, which when you go to a clinical situation where the nurses, you are seeing them, they are not doing it properly. Okay, so this situation you can take it from your practical experience. You can do a research study on knowledge, attitude and skills in knowledge, attitude and practice of hand hygiene in a hospital. So this, like this, there are plenty of experiences you gain through your practical or clinical field. So nurses gets plenty of ideas to formulate research problem from their clinical experiences. So every curious nurse has several questions to be answered. So especially when you link knowledge, when you link theory and practical, you will get plenty of experiences which you can use it in your research. The next is critical appraisal of literature. So when you think of any topic, a broad one, if you put it in your internet or you look into a journal, you will find lot of informations on that topic. For example, if you are interested in hypertension, so if you just go through in a Google Scholar or PubMed or in your journals regarding the research related to hypertension, there will be plenty of literature available. The review of literature will give you lot of information on specific topic, so you can use it for your research problem. When we critically study books or articles related to subject of our interest, including research report, opinion articles, journals, okay, any of these things will give you a source for your research problem. These may strike readers' mind indirectly by stimulating imagination. So when you go through these articles, it may stimulate your imagination, which leads to a new research problem. Here they have given an example. Here a nurse reads an article on the prevalence of pin site infection among patients with external fixators. So this article might have stimulated your imagination to do a research on knowledge of pin site care in patients. So this is one of an example for critical appraisal of literature. So next is previous experience. So of course, as a researcher or as a student, you may have some experience. Those experience you can investigate or you can put it as a source of research problem. A body of knowledge should be developed on a sound foundation of research findings. Usually at the end of the researcher, further research problems are suggested. So whenever you do a research, at the end of the research, you will be doing a recommendation part, that is, you will suggest recommendations for the coming new researchers. So if you go through any articles, if you read these recommendations, it will give you an idea on a new source of research problem. And the next is existing theories. So we have lot of theories which is applied in our nursing. So those theories, you can either test the theories or you can redefine the theories with the help of the research. So you can take any of the theory, you can develop it or redefine it, or you test it with the help of the research. Nurses use many theories from other disciplines in their practice also. So an existing theory is used in developing a researchable problems. So for example, Nightingale theory, it's an environmental theory which explains that environment plays a vital role in health. So for example, like if the environment is clean and hygienic, your infection in the hospital is reduced. So this is one example of Nightingale theory. Either you can prove it with the research or you can redefine or try to redefine these theories through your research. The next is social issues, which is very common. Whenever you select a research problem, the existing social issues or current social issues or political problems, you can take it as your research problem, but make sure that it is of your discipline, that is, it should be related to health or nursing. So all the social issues which is current issues, you can take it for your research problem. For example, at this time, if I ask you to select a problem, at least few of you will focus on the COVID-19 issues or online teaching, what we are experiencing now. So sometimes topics are suggested by more global contemporary social or political issues. So for example, HIV, AIDS, female feticide, sexual harassment, domestic violence, gender equality, healthcare like COVID-19, coronavirus, knowledge on coronavirus, online education, online teaching, all those things can be considered or selected as a research problem. So social issue is a very important aspect. The next one is brainstorming. Sometimes if we think individually, we may not get good ideas, but when we sit together and discuss, lot of ideas generates from the discussion. So that group discussion, intensified group discussion, we say it as brainstorming. So brainstorming sessions are good techniques to find new questions, where an intensified discussion among interested people of the profession is conducted to find more ideas to formulate a research problem. So sitting with the same group of people and discussing about topics, of course, gives lot of research ideas. The next one is intuition. From this picture you can see the Einstein sitting under the tree. When apple fell, he found something remarkable. So same like this, when a spark of idea may emerge from the researcher's mind at one point. So of course here the Einstein is having the phone, that's why a lot of apples fell and no ideas have been emerged from his mind. Okay, traditionally intuitions are considered as good source of knowledge as well as sources to find new research problems. So it's like the dairy milk ad where the chocolate breaks, same like that you will get an idea, a spark at any moment in your life. Folklore. So this is nothing but the common beliefs or cultural beliefs which are practiced even nowadays by a group of people or a group of in an area or in an environment which has been, you can test it for your research problem. These common beliefs can be right or wrong, you can prove it like whether it is right or wrong. So the beliefs which are practiced by some group of people, you can take it as a research problem. Here I have given, generally it is believed that studying before the test decreases the score. Yes, always, but every student you can see that they will have their book in their hand just before entering their exam. So there are students who believe that just before exam whatever they read, it comes in their question papers. So like this there will be lot of beliefs even in the student point of view or from the teachers or from the cultural practices, which you can test it or take it as your research problem. The next is exposure to field situations. That is nothing but your clinical field exposure. So when you put on a clinical field experiences, of course those things can be taken for your research problem. While working in field, a researcher observed a specific traditional practice for cure of disease condition which can be used as research problem. For example, you are studying these diversional therapies in the theory and you want to apply this. You have seen that none of these diversional therapies like music is not applied in the real practice. So you can try putting these diversional therapy in the research field and you can do a research. So this is one example of exposure to field situations. So the working field or the clinical area, you can use it for your research problem identification. The next is consultation with experts. As you all know, whenever we do research, we will be put under a guide. So the expert's opinion is very, very important because whenever we do research, we may need more knowledge which is specific to that research topic. So you can approach the experts to gain those knowledge. Experts are believed to have a sound experience of their respective field, which may suggest a significant problem to be studied. So in addition, expert may help in finding a correct problem for discipline. So a solvable problem, so you need an expert's guidance always. That's why we all are coming under a guide when we do a research. So I will finish it with this sources of research problem. So the sources of research problem includes personal experience, previous experience, practical experience, clinical field exposure, consultation with experts, brainstorming, intuitions, folklores, critical appraisal of the literature. So all these things, from all these things you can get or you can select a research problem for your research studies. So thank you for watching. We will see in the next class regarding the criteria of a good research problem and how to write a research problem statement. Thank you.